Good morning. Welcome to the Women Empowerment Conference, our Women in Healthcare panel. My name is Sarah Helmus, and I am one of the committee members of the Women Empowerment Committee, along with Gabriela Mata, who's helping me out today with our virtual panelists. We are so happy to have a panel of excellent women serving in healthcare. And as you're joining us today, please just keep your microphone muted, but turn on your camera if you are comfortable. We would love to see you. We're going to let the panelists answer some pre-prepared questions, and then towards the end, we will open it up to any questions from participants. So since we have a larger panel, I'm going to let them introduce themselves. So the first question that I had them prepare was, give a brief introduction of yourself. Tell me about yourself. And I'm just going to go in order of how you all appear on my screen. So I don't lose track. So Jennifer, I'll have you start introductions.
All right, so my name is Jennifer Reft. I'm a physical therapist. I graduated in 1993 from Marquette University. Almost all my experience is hospital based in rehabilitation, acute rehabilitation, and day rehab. A couple years ago, I got my transitional doctorate, so I have a DPT now, and I'm currently actually in school for a Doctor of Health Science. In the past, since not that long ago, since 2009, I've been teaching at Morton in the Physical Therapist Assistant Program.
Thank you. Welcome. Deana?
All right. So my name is Deana Canaveral. I'm a certified physician assistant at Londo Christian Health Center on the west side of Chicago. I graduated from Morton College in 2014 and then transferred to UIC, where I did my bachelor's in biological sciences with a minor in chemistry, and graduated in 2016. And then while at UIC, I did the EMT program, and I became an EMT and did about 6 months of working on an ambulance, and then transferred to the ER at St. Anthony Hospital. And then from there, I worked there for almost 2 years to get a lot of my hours for PA school, and started PA school and recently graduated in September of 2020 and got hired in November. So that's what I'm currently doing.
Wonderful. Thank you. Julie?
Hi, good morning. My name is Julianne Herrmann. I am a full-time nursing faculty member here at Morton College. I graduated from Elmhurst University in 2009 with my nursing degree for grad and undergrad education. This is my 9th year at Morton, working with teaching nursing. My specialty in nursing is adult health and ranges anywhere from medical, surgical to complex. And I'm really happy to be here with everybody.
Thank you. We're so happy to have you too. Crystal.
All right, my name is Crystal. I graduated from Morton College in 2015, and I actually started off my nursing career in a nursing home for about 2.5 years. And from then I went on and started working in the surgical trauma unit at Mount Sinai Hospital. And just this past October, I transitioned to the ER at Mount Sinai, which is a level 1 trauma. So I've gotten a lot of experience there, definitely.
That's great. Thank you. Kate.
Kate Wilkins. I'm a family medicine doc down in Carlinville, Illinois, which is just south of Springfield. I graduated from SIU School of Medicine in Springfield in 2007, and then did my family medicine residency in Milwaukee at St. And then transferred down to Carlinville, where I've spent my career doing family medicine. I started out as doing sort of a full panel, both inpatient and outpatient and nursing home. And then once I had kids, I transitioned into just doing straight outpatient medicine.
Great, thank you. And Jeanette.
Hi, my name is Jeanette Rodriguez. I'm also a Morton College graduate. I graduated this past May, so I'm still new in the field. I am currently working in Edwards Elmhurst in the urology department, and I did just go back. Also, I started in January at Benedictine for my BSN. So it's been nonstop school for me, kind of. And I do plan to continue that going forward. I just really haven't decided yet if I want to do like teaching like in the office or some type of like NP program or anything, but it's a good start for me.
And then we're going to share one other introduction with you via video.
Hi everyone, my name is Cynthia Salazar. I am joining you from my living room because by the time you watch this, I will actually be working. It's nice to meet all of you. Thank you for having me on this panel, even if it's virtual. A little bit about me. I am a second year family medicine resident physician at Advocate Christ Hospital. I am doing a 3-year program there in the family medicine residency. Family medicine, we treat patients from 0 to 100, really. So our patient population is basically everyone, including pregnant females. And we also get vaginal delivery training, which is nice. And so aside from residency, I love to play soccer. So I have played soccer my entire life, and I still have tried to find a way to still keep up with it, even though COVID tried to ruin that. But we are starting up again next Monday. And aside from soccer, I love food. I love to cook food. I love to bake. I love to go out to eat, most of all, because I don't have to do my dishes. And living in the city of Chicago has really allowed me to try different places and kind of experience the city.
Wonderful. So again, we are so happy to have you here. And the next question is, what drew you to the healthcare field? And if you've been in it a while, why do you stay? Like what does it do to encourage you to stay? And so I'll just go in the same order that we did last time and let you all answer that, and we'll go from there.
All right. So I guess for me, healthcare was kind of the family business. My mother is a nurse. She's retired now, but she was a nurse for like probably close to 50 years. My dad is also recently retired, but he was a medical physicist. And if you've never heard of that term, those are those physicists actually deal with the machines for radiation for cancer and treatments like that. Anyways, so, when I was, starting to think about, what I wanted to do, I thought about being a doctor, even though I knew that wasn't really what I wanted to do. And it was my mom who said, oh, maybe you'd be interested in physical therapy. And her comment was that, and I found this to be true, that there's a lot of flexibility in the healthcare field. Which I found, it's just like, well, so, if you want to have kids, you can, it's easy kind of to take some time off and then come back. And it was kind of suggested that maybe that might be something. I was kind of leaning that way anyways. I looked into it, and it was everything that was advertised in the sense that I found it, interesting, and physical therapy, especially, there's a lot of different things you can go into. So if you sort of get bored with one area, you can go into another area. And I have found it to be really flexible in a way that some other professions are not.
All right. So for me, my pathway to healthcare was a little bit more complicated. When I was studying biology, I had my niece who was 7 years old at the time around there, and she actually had high blood pressure and she had to take medication for it when she was little. So she was asking me one day in the car, like, hey, how does the medicine get to everywhere in your body? And I had just learned about the circulatory system, and I was like, hey, let me teach you this. And so from there, I fell in love with kind of like teaching medicine, at least to like a younger kid. And that's when I felt the pull. When I was at Morton College, I still felt the pull, but I admit that I was very, very intimidated. And for me, I think it was because I was Hispanic, and like doctors my entire life were not Hispanic. And I was like, oh, I don't think it's something that Hispanics do, And so that was my intimidation. And so I actually transferred to UIC as a business major. And when I got to UIC, I was like, I cannot do this, and I just need to go for medicine. And so that's when I switched to become a biology major with a minor in chemistry. And from there, that's when I kind of, saw different aspects of the medical field, and I fell in love with being an EMT and working in the ER. And I was like, yeah, I want to become a PA. And so I became a PA because my mom's cardiologist actually told us about what the PA physician is, or the PA role is. And I fell in love with the flexibility, and I thought it would be a nice work balance because in the future I want to have a family. So from there, I became a PA, and right now I love it. I completely love it. I think the patients is my main motivation, just seeing them eye to eye and seeing how much they appreciate us being there for them. That's what keeps me there right now.
Okay, so my story kind of starts way back when in 8th grade. And actually in 8th grade, when I was going to apply for my confirmation, we had to do volunteer hours. And so I was kind of looking for opportunities in the community for where could I do my volunteer hours. I knew I didn't want to babysit because that was one of the options for your confirmation was you could babysit. And I said, no way, I'm not babysitting. So I lived maybe a mile away from Lutheran General Hospital in Park Ridge, and I saw an opportunity to volunteer in delivering flowers from the flower shop to patients throughout the hospital. And so I thought, oh, that sounds like a great, fun volunteer opportunity. You walk around in your little candy striper wagon and, drop off flowers and such. And so I did that for my confirmation, got my hours in, and I really enjoyed it. And so I ended up sticking around, and I did flower deliveries, and then I started to volunteer in the flower and gift shop. And when I started working in the flower and gift shop, and I got to, people would call in and they would order different items to be delivered to the patient's bedside, I would always be the first to volunteer to take it up to the patient's bedside. And I got to see the units and working bedside, the nurses working bedside, seeing the patients and interacting with them. And that's kind of where the passion started. Then when I, continued through education in high school and that type of thing, I was very interested in the sciences. It was always one of the strengths of mine. And I couldn't decide whether to go the nursing route or, PA or physician route or what I was kind of looking to do, but I knew I wanted to do something science related. And my sister, kind of like Jennifer, she was in nursing school at the time at NIU. And she said, why don't you come down with me for a couple classes, see what it's all about. And so actually I went down to NIU and I did a couple shadowing classes with my sister, and I absolutely fell in love with it. I love the flexibility of nursing. I love the direct patient care, the ability to always be there for my patients. And that's kind of where my passion for nursing started. And now it's really transitioned into teaching new members of the nursing community that want to go into nursing, just kind of working on their passion towards that and guiding them towards why nursing is so wonderful. And that's kind of how I got into teaching, is just, I love working with students. I love the education aspect of it and just empowering students to become nurses, especially in this community. It's a community that I absolutely love and have refused to leave because I love the students that I get to work with, and kind of shows because I keep in touch with so many of you guys, and I absolutely love that. So that's kind of how I got from nursing to education, and how I'm staying here for, it's been 9 years now at Morton, and I'm not leaving because I absolutely love what I do. And I love working with the students, and I love nursing. So putting them together has been absolutely wonderful and a blessing. So thank you.
For me, it started when I was younger. My mom's a nurse, and she's been an LPN for years, and she used to go to Morton College. She was in the Morton College nursing program as well. But I remember there was one time when I was in kindergarten, she had nobody to pick me up. So she picked me up, and the instructor actually allowed her to take me there. So I was sitting in the anatomy classes, paying so much attention. And I remember they were learning about the eyes. And that's when I really became intrigued in it. And my mom would always talk to me about how fascinating the body is. She'd come home, tell me about work. And another time where I remember I was like, okay, I want to go for nursing was when I was a teenage mom. I was pregnant, and in my delivery room, there was a nurse there. She was so caring and she was wonderful. And she told me, she's like, I'm staying by your side until you have this baby. And she stayed like 2 hours past her shift until I had my baby. And that's when I'm like, okay, I want to be a labor and delivery nurse. Once I was in the nursing program, I did clinicals like in all different fields. And I was like, yeah, labor and delivery is not for me. But I did do a rotation in the ER once at Mount Sinai. And I was like, okay, this is what I want to do. I love the adrenaline. I loved how I saw everybody working as a team. So that was my goal. It took me a while to get there. I started off in a nursing home. I had some good experiences there and some not good experiences. But then I worked my way up to surgical trauma, which I learned a lot more there. And now I'm in the ER. And the reason I stay is because of the type of people that we take care of. We take care of the people who really need our help, the minorities. And it's nice seeing them appreciate what you do. Like you get these patients who are not so appreciative and those that are. But when I first started in the hospital, I remember I was in the bathroom texting my mom. I was like, Mom, I don't know if I can do this. Like, I really don't. I was so out of my comfort zone. It was so stressful. And like a week later, I was like, okay, let me give it more time. Let me give it more time. A week later, I had a 20-year-old who had been shot. She was crying because she could not wash herself up. And I'm sitting there comforting her, helping her wash up. And I'm like, this is why I'm here. This is exactly why I'm going to stay for patients like her. And here we are. I'm still here.
The class of I was 5 years old and knew I was going to be a doctor. I have no idea why. I didn't really have any medical people in my family outside of my dad, who was at the time was an X-ray tech, and then eventually a CT tech, and then an MRI tech, and actually retired after his entire career in one hospital system, just sort of moving up as the technology increased. So I saw him in that, but I didn't really have exposure to physicians outside of my own pediatrician. It was one of those things that I knew. And that held through until 8th grade, when for about 6 months, I decided I was going to be a chef. But then I decided I actually like to eat. It's not the making of the food I enjoy all that much. It's the eating of the food. So that, again, 6 months maybe. And then I was back to being a physician. And so it was not really a choice, I guess. I just knew that was what I was going to do, which is kind of a shame. I didn't have a backup plan in college. That was what I was going to do. I was going to be a developmental pediatrician. And then I got into medical school and kind of decided, well, I actually want to be a general physician or a general pediatrician, because then I can work with all kids, because then you still see the children with disabilities when they're in all the time, is, for their whole lives. And then I did they had a mentoring program my first year of medical school, and they put you together with someone who specializes in what you want to do. And it turns out I want to know kids beyond when they're sick. And a lot of being a pediatrician is knowing how to talk to parents. And so I wanted to talk to parents when they weren't just stressed about their kids. And so I sort of transitioned over into family medicine because I missed adults when I was doing the pediatric rotations. So now I get to do a little bit of everything, just like she said. It's, I saw a patient who was turning 100 tomorrow on Friday. And I also saw a 3-month-old. So all in the same day. So you get a little something different every room that you go in, which I think is really cool.
Sorry, is it me? I forgot what place I was in. But so like my passion for nursing started for as long as I can remember. I always knew in high school and even before then that I wanted to go into the medical field. So after I graduated high school, that fall, I actually started my prerequisites in Morton. I was about a year and a half in, I want to say, and I just got cold feet. I was like, I don't know if this is for me anymore. I got so close to starting the program at that time, and I remember feeling like, okay, I, I don't know if I want to do this anymore. So that same, like within a couple months, my friend told me about medical assisting, and I went to the program there, and it was in a different school. And I was like, okay, like I feel like this is a good way to get my feet wet and test the water here. So I went to school for medical assisting, and I was a medical assistant for like 8 years. I started off in GI. I went into dermatology for like 6 years. And that is where I was like, okay, like I think I would do nursing eventually one day again. I loved how our nurses in dermatology just really provided that care for our patients, the instructions, the education. They just provided more during like minor surgeries and procedures that we would do. So I was pretty limited. I did feel a little limited with my resources there. And I just said, okay, one day I'll go back to nursing. I'll finish my prereqs and go into the program. And then my cousin, who's like my sister, had her baby girl really early, and she was in the NICU for like 3-4 months at Loyola. And I just felt so devastated because I've never seen my family so scared. I've never seen my cousin so scared. And I was just like, I need to like be this strength for her. And I need to be that strength for her husband, for my family, for her daughter. And so that's where I got my push to be like, okay, I need to do this now. So she was born in November, prematurely. And that January, I went back and finished my prereqs. And I went into the nursing program, I think that like following fall. And I wanted to, the reason why I stay is for that, because even one day I see what I provide for my patients. Now, even being a new graduate, I see the relief on their face when they see a Spanish speaking nurse, and how I can help them understand their condition, how they can manage their condition. That gives them control over their health. So I want to do that even more eventually at one point. So that's why I stay.
So I get this question a lot. Why or how did I get into the healthcare field? And it's a very hard question to answer. I will say, for as long as I can remember, I don't know if I saw it on a TV show, a movie. When I was very young, my mom bought me a first aid kit. Actually, she didn't buy it for me. She bought it for the house, but I made it mine. And I would walk around and just, putting Band-Aids on people, ice packs, just trying to it was my sister, really, my parents at that time. And I even liked taking the ace bandages and wrapping people. So I don't know where the interest came from, but as I got older and older, my family would, my mom especially, she'd be like, oh, you're going to be our doctor. You're going to be our doctor. I don't really think she understood what that meant. We don't have doctors really in our family. But it was something that I think my mom saw early on that I wanted to do. And as I got older and as reality really came in, it kind of brought about a lot of self-doubt. And, I would run into people, even my undergrad counselor, who knew that my dream was to go into the medical field, at some point basically was telling me, I want to say my junior year, which is the time you would start applying to medical school. She said, you're never gonna get in. She's like, you don't have straight A's, XYZ, these other reasons. So that, and then on top of that, my family also, unfortunately, and I don't blame them, but they'd say, how are you going to have a family? How are you going to raise your kids? If you want to be a doctor, that's very hard. and it's also a little bit of ignorance, like not understanding, not knowing anyone in the field, not knowing how to guide me appropriately, which is fine. But there was a lot of, oh, maybe you should go into nursing, maybe you should be a PA, it's better hours, better time, things like that. So I think I did not end up applying my junior year when I was an undergrad, just with all of the I would say the negativity, and I just didn't think I would get in or couldn't do it. Even after I finished undergrad, I ended up saying, I need to do something to buff my resume. And so I ended up going to EMT school at Loyola, and worked as an EMT for a while, which was great experience. It looks good on the resume. Some other people take another pathway, getting a post-bac program or a master's or something like that. And so I ended up being an EMT. And I actually, when I was an EMT, I actually really enjoyed it. And I even thought, if the medical field doesn't work out, I'm going to continue, get a paramedic license, and then become a firefighter, which was actually my plan B. So I always wanted to get into the medical field somehow, and just be out there helping people. And so I want to say it wasn't until I saw my primary care doctor that, he told me, oh, he knew I wanted to be a doctor. He asked me about everything. I said, I haven't applied. I don't have, straight A's. I don't think I'll be able to get in. I don't even know how to get in. I didn't even know how to apply because it's a very extensive process. And I really didn't have much guidance in a sense, and I didn't even know where to look for it. So he ended up saying, you know what? He's like, right now it's the off season. This was sometime, I want to say in January. He said it's the off season. However, there are other options. If you don't want to wait till November to apply to the next cycle, he's like, you can apply to a Caribbean school. And I recommend Ross University, which is where I ended up going. He said, I have a lot of colleagues that went there, and they're pretty good in their fields. He's like, they're top in their fields and they do excellent training. He's like, you should really consider it. And honestly, I feel like that's what it took for me to just, I got my resume together, I had my scores together, everything ready to go. I want to say I applied March, so 2 months later, and then I got in by April. And so then, as soon as I got the acceptance, after my interviews and everything, I packed my bags and I never looked back. And Ross University was in Dominica, which is a very small island off the coast of Venezuela. It doesn't exist in Dominica anymore. They actually had to move to Barbados after the hurricane. But it was one of the best decisions I've ever made. And I never looked back. It was truly amazing. And I encourage anyone to consider going to a medical school in the Caribbean. Why did I stay in the field? I mean, I feel like once I had that golden ticket, once they accepted me, I said, this is it. Like, my dream is actually going to come true.
That's awesome. Thank you. It's really neat to see all the similarities within the story too, the family connections and just knowing, I think that's really, and some of the challenges that we face to get there and to really pursue that goal and stick with it. I'm going to skip one and move on to what do you like best about your position in healthcare, and what maybe do you like the least? Or what's one of the challenges that you could do without but comes with the job?
So I think that what I like best is it's always, and people have commented on this, it's always something a bit new, what patients have or their problems or the issues. And so you have to think about, for physical therapy, you have to make up a plan, you have to adjust it to what the patient presents in front of you. You have to assess where they're at and then, kind of figure out what's going to be best for them. And it's fun to have that challenge that's fun, but it also can be a challenge. If you're with somebody who, just doesn't feel like it that day, and then you have to shift gears and you've got to be more kind of a psychologist, and you've got to work on, how to get them involved. And that's a whole nother thing. But sometimes patients are just difficult to work with. It's a very, I've always worked mostly, like I said, hospital-based, a lot with neuro patients. It can be very physical. And there was a period of time, like I had, if I had a bunch of left CVA people with left stroke, so their one side was really weak and I had to support them on that side, I felt it the next day, because I had a bunch of people that I had to really support the same way. So physically sometimes it can be challenging, and doing your best, but then it can also be just really rewarding when you accomplish something, or that's the first day the person walked, or the first day they went up the stairs, and you share in that accomplishment. And it's always funny to me, sometimes patients will say, oh, you did it, and it's like, of course I didn't do it, you did it. So it can be difficult to work with patients, but it also can be, it's also more rewarding really than almost anything else.
All right, so for me, I think I have two favorites. So one is the flexibility that comes with the position as a PA. I really, really enjoy that you don't have to specialize in one and then, be in that specialty your entire career, where, like, let's say I'm doing urgent care for 10 years and I feel like I'm getting burned out. I can switch to OB, or I can switch to peds, or I can switch to anything that I want to switch to, because we've been trained to do everything. As long as somebody's willing to hire me and kind of help me catch up on things that maybe I'm are a little slacking on, then we can do that. So I really, really enjoy that. And I also love the autonomy, yet the collaboration. So I feel like we're very autonomous, and we can see our own patients, and we can diagnose, and we can order, and we can prescribe and make treatment plans. However, we still have that buffer of having a collaborating physician, where if we're stuck or we don't know how to go in the treatment plan of one patient, then we have that backbone to rely on with our physician. So I think those two are my absolute favorite things about being a PA. The thing I don't enjoy, and it's the least favorite of the position, is the name. So I feel like the name is very tricky for some people, because it's physician assistant. So a lot of people would be like, oh, so you're assisting the doctor. You're like, no. We have our own patients, and we can diagnose and take a full history and physical exam. And so that's very hard, even though we're becoming very large in numbers and people are getting our name out there, and people are starting to know who we are. I still get a lot of patients asking me every single day, like, oh, what's a PA? You're assisting them, right? And I'm like, no, let me tell you what it is. So that part can get a little bit annoying, but overall I absolutely love it.
It's okay, Deanna. We get that we're physician assistants all the time, that we're the doctor's assistant all the time too in nursing. So I feel your pain, even though we love our docs. We love our docs. Okay, so when I looked at this question, I looked at it from the nursing education perspective now, because that's my passion, and that's what I'm working in now as far as nursing goes. And so my favorite part of nursing, and it's kind of cheesy, but it's the pinning ceremony. It's my favorite part of nursing. And if you've never participated or are not familiar with the pinning ceremony, it's an event that happens just for nurses, and it's like their own type of graduation, except there's a series of events, and it's just really nice because it's for our profession. But my favorite part is seeing them up on the stage, and then really seeing their families, because you see the behind the scenes. So we see the student, but we don't see what's happening at home. We don't see the families they talk about. We don't see the kids they sacrifice. So when we see it all up on the stage and in front of us, the pinning ceremony is probably my favorite part of teaching, because I absolutely love it. And then probably the least favorite part is the when students are unsuccessful. And I thought, as time would progress, that it would get easier to see students who are unsuccessful in your classes, but it doesn't. It never gets easier, and it's the most painful part of my job. It's always the part that I do self-reflection. What could I have done on my end to help that student succeed? And so it's always the most challenging, but it's always the area that I find I have the most growth, and where I do the most self-reflection on what can I do better to have my students be successful. So I always, at the end of the semester, at the end of the year, that's kind of my evaluation, is student success is my success. And so you try to bring that forward as much as possible. So that was me.
So for me, I love a lot of things about my job. One, I love the type of people we take care of, minorities. They're always the most grateful for like what you do. And I love in the ER setting how everybody works as a team. You are never alone. No one will ever let you drown. They go to help you without asking for help. And I've learned so much. I've honestly learned so much about nursing, but about myself as a person as well. Um, it, it's taught me to be patient, but it's also taught me like where my boundaries are with certain things as well. And a couple things I don't like about it is the stress. I run on adrenaline 12 hours a day. And I work with difficult patients as well. I've been threatened, I've been yelled at, spit at, been tried to hit. So it's things like that. It's kind of like, oh, why am I doing this? But you got to kind of remember, like, no judgment. You're there to help them. We don't know what's going on in their lives. We're here to try to make their sucky day a little less sucky. It's been difficult for me transitioning to the ER because, like I said, I run on adrenaline for 12 hours a day, and then I come home. I have 4 kids at home who are wild kids. And so I had to learn how to like really de-stress and stuff. But I wouldn't change what I do for anything. I absolutely love nursing.
I love the patient care. I love sitting in a room with a person, listening to them tell me about what things ail them. So if that's their depression that's gotten out of control because they're stuck at home with COVID in the community, if that's their blood pressure is too high and they don't know what to do next. I really enjoy listening to that and sort of brainstorming with people to figure out how we're going to help them feel better. Or explaining to them that even though you don't feel bad, you have this problem and we need to fix it so that you don't feel bad later. And sometimes there's an art to that of, convincing people who feel fine that, 5-10 years from now, you're not going to feel fine if we don't do something now. So I really like the challenge and the teamwork that Crystal mentioned. I have that with patients too. We're a team together. You drive the ship, I navigate. Let's do this. I really, really love that. And if I could do just that all day, it would be great. Which brings me to what I like least is the paperwork and bureaucracy behind medicine now. Everybody's nodding their head because we all have to write down in triplicate what we've done for the patient, what we said to them, how we came to that decision. And then there's the paperwork you have to sign that came over the fax for somebody to get the medication that they need. And then you need to call the insurance company to get something covered. And then you have to collaborate with other providers who are also taking care of your patient and read their notes and update their charts and all of that stuff. That's the stuff that happens behind the scenes. No one comes to your office. And so they wonder, why are you running 10 minutes or 20 minutes behind? Well, I was on the phone with the ER talking about a different patient who isn't on our schedule. And so that is what wears me out sometimes. But you have to sort of know going in that that's part and parcel to what you do. Some days it's better and some days it's worse. So that's the part that gets me.
So I think for me, the best thing that I love right now is definitely the mix of duties that I have. Even though I'm in the office, I don't feel like I'm losing any nursing skill. And I'm learning, the different triaging over the phone, the documentation that I have to do, the charting. So I really like that continuing education that as that goes for me. I like to witness the recovery and be part of that team and the collaboration with our entire team, our doctors, our other nurses, our NPs. it's very rewarding to see that and to know that you had a part in that, and you see the relief and the satisfaction in a patient's like face, and then they come back for their follow-ups, and it's like it's really nice. I think that's the most rewarding for me. I like to provide that advocacy for them and that education for them to like have that control. I think what also like the most is like I don't work weekends, which gives me a lot of free time. So I think that's like just a little little side for me. What I think that my least favorite right now is probably that I'm still new, so I'm still a little stuck here and there, but I have a great nurse lead to rely on, and I think that's also what I like is that misconception I don't like is that misconception of like the nurses eat their young. Like that is not true. At least I can witness that it's not true. Like she's always there. She's not like overlooking my shoulder or making sure I did this right, did this wrong, but she's like so helpful, and I'm so grateful for her. I hope she never retires. But I think also a thing that I don't like, well, not that I don't like, but I mean, my least favorite is that the providers, they're not in the office every day because they have to do surgeries like 2-3 days a week. So like our communication is pretty limited. But that is where I turn to my nurse lead about, you know, our autonomy and what can we do as nurses. Sometimes I do catch myself like, I'm stuck and I'm like, oh my God, I need a nurse. And I'm like, wait, I'm a nurse. So that's a little, I have to like catch myself like, okay, like it's me, it's my turn. But I'll get there. I'll get that confidence and that comfortability. I'm getting there slowly but surely.
What do I like best about my job? I love that you are basically a detective. You know, you have somebody that will come in with all these clues, and you need to know which questions to ask in order to connect those clues to figure out what's going on. You know, and what's amazing is every now and then you get a rare case, which just, you know, it makes you feel so excited, especially if you crack it. You know, recently I had a patient who came in with fevers, rash all over her body, joint pains, no appetite. You know, looking at her labs, her liver enzymes were high. She had just come back from Las Vegas. And so, you know, you're just like running through this library in your brain of all the training you've ever done. You know, you got to think about common things, but you also got to think about serious things, rare things. And, you know, it ended up being a tick called Rocky Mountain Spotted Fever. That's how rare it is. I can't even tell you the name, but I know what it is because we learned about it, which is actually very, very serious if it's not treated. It has very high mortality. So it was very exciting to be able to have different ideas of what I thought was going on, talk it over with one of my attendings, and then for them to say, yeah, that's exactly what it is. So it's moments like that I'm like, this is exactly why I came into this field, you know, because I want to help people. I want to use my mind to put the clues together and come up with a solution. Another thing I love about my job is that half of my patient panel is Spanish speaking. And so I just, you know, in a lot of these patients, I see my own family, I see my grandparents, I see my parents. I can relate to them. I understand their home remedies, and just the culture of medicine coming from a Hispanic background. You know, it's easier to relate to them. It's easier to communicate things to them, educate them on their health, talk to them about their diseases or whatever's going on at the time. And I've found that it's been so beneficial when you're able to speak the same language as your doctor. Or any other person, you know, language barriers play a huge factor when it comes to healthcare and being able to understand what it is that they need, what their symptoms are. Even using translators can be an issue because things don't get translated correctly. And so that's another thing that I love, is that I can use my Spanish. What do I like least about the medical field? I would have to say that you can't save everyone. And, you know, over time, I know people say, oh, you guys get so blunted, you know, you don't get emotional anymore. But I wouldn't even say that's true. I think that we do carry a lot more than we should. We bring it home. But I think that also because we understand there's a point where you can't do more sometimes. I think it's just a little bit easier for us to accept it in a sense, but it's never easy. You know, it's never easy walking into a room and telling an entire family, you know, they're just not going to make it, or we did everything we could. I think that's one of the things that I like least about medicine.
So I'm going to take the last two and combine them and ask you what or who, maybe I realized after I sent the questions that it could be a person or people, helped you get to where you are today, whether that's through school, into your career. And what is one piece of advice that you would give to someone who's interested in starting out towards a career in healthcare?
So I guess, I mean, my family was really supportive. Once I think you get started, I think it does really help to seek out mentors, either at school or like on your first job. And I think, you know, you'd be surprised how willing people are to give of their time and expertise if you ask. You don't know if you don't ask. You know, it's really easy these days to reach out through even social media or email. You know, people can always not respond if they don't want to. But I think people really are interested in, you know, if they enjoy their job, they want you to do their job too. So don't be afraid to reach out to people, to follow up with people, you know, and, you know, find people out there who support you, you know, who don't tell you that maybe, I mean, everybody I think has described how it is difficult, it is hard. And so you do need to kind of reach down and remember why you're there, and make sure that you've got people in your life that really are supportive. And I don't want to say cut out, but maybe kind of put aside those people that maybe are not so supportive.
Yeah, so for me, I would say my family was a huge help. And like how she was saying, they definitely supported me in this. My family often tells me that they didn't see me for 2 years straight because I was always in my room studying. And honestly, I was able to do that because they were all there being my support, and they were making sure that I had food and that I had clothes, and I didn't have to worry about those things because they were super supportive. And I was able to just disappear for 2 years and, you know, see you then. And so with that being said, I would say that a piece of practical advice that I would give, knowing that imposter syndrome is very real in the medical field. And so imposter syndrome is like where you're there, but you're like, am I really supposed to be here? Like, am I really qualified to do this? And Jeanette, I totally understand you because I'm new and I doubt myself all the time. And I'm like, I need a PA or I need a doctor. I'm like, oh, wait, that's me. So I totally understand that. And I feel that something that my mom once told me during one of my rotations is I came home and I was, you know, stressing about a patient that I had that day. And I wasn't sure if I handled it correctly, like in clinical decision making. And so I was telling her about the case. And one thing she told me was, you've already put in the hard work, so you trust in that. And so my piece of advice is to do the hard work now. Like, seclude yourself for years if it takes years, because when you get to the point where you're practicing and you're out in the field, you have this confidence to do it because you know that you already put in the hard work. You already took sleepless nights and you already studied as hard as you could, and you did the work in the moment. So now you can rely on the fact that you're prepared. And even though imposter syndrome is real and you don't feel like you're prepared, you can always rely on the fact that you did the hard work. So that's what I would say now. Take advantage of the fact that, like, at Morton College, I tried really hard to do the hard work, and UIC I tried. And so all of that was preparing me to go to med school, to all of the study habits that I practiced in Morton College. And I was like, okay, maybe that didn't work. So then I tried something else at UIC. Maybe that didn't work. But all of those practicing different study habits really carried on to med school, where I was like, okay, now this is how I do it. And you put in the hard work and now you're ready. So that's what I would say.
Similar trends, so definitely family support. My family, like Jennifer and Deana mentioned, just being able to take time away from work to do those clinical hours and get that degree done by having, support from my family was definitely a huge help, but then also personal drive. And I see it, even in the women here today, like Kate mentioning, she was 5 years old, she just had this drive. And I say, go for it. Keep, on that personal, whatever is inside of you, don't let that light be diminished by someone else. I've always said that I kind of have that go-getter personality. I've had thick skin. If someone tells me no, I'm going to do everything I can to make sure, that you should have said yes, because you don't say no to me, right? But just that personal drive, I think, take it forward, go with it. And, one of my favorite quotes is just go out into the world with your passion and love what you do and never give up. Don't let somebody stand in your way. I've heard a few people mention that, someone had told them no, or that you wouldn't be able to make it into a program, or that you just don't let anyone get in your way. If it's what you want to do, go for it and be your own personal support and your personal drive. So it's my kind of advice. You can do it.
For me, it was definitely my family. My family supported me 100%. But like Julie said, personal drive. After I had my daughter, I had a lot of people tell me, oh, your life's over, you're a teenage mom, you're gonna end up working at McDonald's. And I'm like, that's not gonna happen. And looking at my daughter, I'm like, okay, I have a human being I have to take care of. Like, I'm responsible for you. So even after I had her, I pushed myself so much more in school. I started school 2 weeks after I graduated high school. And she's the one that really pushed me to like continue with my education and want to become a nurse. And also my husband, he's been my backbone. He's supported me 100%. He put up with my mood swings during nursing school and everything. But yeah, it was mostly family just telling me, yeah, you can do it, you can do it. And a piece of advice that I would give for somebody would be, don't give up. You're going to have people tell you no, you're going to have people put you down, but with you knowing what you want to do, you're able to accomplish that and so much more.
I'm going to say Julie stole my answer.
Real quick, I'm gonna pause you real quick and say, welcome, Anna. We're answering a question of what helped us get through, or what helped get through into the healthcare field, and a piece of advice. So I just wanted to let you know what the question was that you're hearing the panelists answer. Sorry, Kate, thank
you. Starting out, my parents, I mean, I can't give them enough credit. On a test and they say, well, that sucks, why don't you do better next time, and let us help you support that. I got in trouble a year ago. I have moved out of my parents' house a long time ago, but they found out during medical school that I had gone through my couch cushions and collected change during medical school so that I could buy food. Which, not a sob story, but I just knew that I could do it because they had taught me I could do it. And so I didn't even think about calling them and saying, hey, can I have a few bucks so I can go to the grocery store? And my dad got really mad about that. She's like, why wouldn't you have called us about that? We're here to help you. And, it just didn't dawn on me that I should ask them because they had already done so much. And so I was just how the rate was to rely on myself, but to know that there, so that if I need them, they're right there. I didn't need them. I was going to a week. It was just I wanted to eat then. And again, piggybacking on the do what matters to you. So don't go into nursing because your aunt or uncle told you should be a nurse. If you want to be a doctor, or if you want to be a PA, or if you want to be a scientist in a lab, don't do anything just because someone else told you that that's what you should do, even though you want to do something else. I don't know if Sarah is allowed to speak on the panel, but I know that she has a story that is that. I mean, she sort of grew up knowing what she was going to do, and she got out into real life and figured out that wasn't what she was meant to do. And now she does what she's meant to do. So I think really follow that passion, because that's what gets you through the rough times like Deana was talking about of, studying for 2 years. You can't do that if you're not in it. So do what really matters to you, and the pieces fall into place. So go for it.
It's the same. The support came from my family, my mom, my husband. My husband's my rock. Like, he keeps me grounded. He gave me the strength when I didn't even have it in myself during nursing school. He sacrificed so much time, so much overtime, just so I can, have for books and for supplies and all this. And my mom did the same thing. Like, my mom, I'm the nurse. I'm like the first nurse in the family, like the first person who went into the medical field. So they don't really my family doesn't really understand much behind the scenes. But she saw my struggles late at night when I was sitting in the kitchen with just a little light here studying. And she would wake up at midnight, 1 a.m. and she'll be like, "Are you still up? Do you need something? Bring me a little tea, a little coffee." And so her support was her presence there, and her constantly checking up on me as well, making sure I had lunch or money for food or something. She's like, "What do you need? What do you need?" And I'm just like, "Mom, it's okay. We got it. We don't, it's fine. I'm not trying to drain you right now." But definitely my other support came from my friends. I think I'm super grateful and lucky that I didn't have friends or coworkers who were so negative towards my decision to go back to nursing school or start a nursing career. Everyone that I can think of was so supportive and constantly checking up on me, even though if we didn't talk for months or a long time. Also, my managers when I was in nursing school, when I was in family medicine, they were so supportive and constantly checking up on me to make sure that how was I doing in class? How did this test go? Do you need help with anything? On top of their other duties, a little text here and there, what do you need? They gave me so much advice and skills on leadership and management that really helped me, have that in the back of my mind, wow, if I ever decide to do something like this, they were a drive to me. And I think a piece of advice that I would give to anybody starting in the medical field, any medical career, it's going to be tough. It's a lot of work. It's a lot of hard work. It's a lot of paperwork. It's going to be tough. If it was easy, everyone would do it. I think do you see yourself doing the work, and is it worth it to you? Is it worth it to see yourself one day working in the bedside, working in this unit, working with a patient one-on-one, talking about their health, talking about their plan? I think that's what you need to ask yourself. Is that your ultimate goal? Because the work is going to be there, whether you decide to, go through with it, whether you decide to go through your associates, a bachelor's, a master's, or a DNP, the work is there. So like I said, it's tough, but I think it's worth it. And it's definitely something that you need to have on your vision board so you can constantly remind yourself of where you're going to be one day.
one piece of practical advice I would give to you all is you are the only person that can determine your fate. You are the captain. Do not let anyone else tell you what you can be, what you can't be. It's up to you. It's up to you and what you do and how hard you fight for it. If you want to go and be an engineer, figure it out. You want to go and be a doctor? Figure it out. You want to be a lawyer? You want to be anything you want to be? Figure it out. Get the right mentors you need. Get the guidance. Now we live in an era where you can Google, you can ask around, find someone who can guide you because you need help, and it's okay to ask for help. Not everyone has it together. Some people are fortunate to have parents or uncles or close family friends who are able to help them, guide them. But if you're not one of those people, find someone who's going to give you the advice and the guidance to get there. And if you guys want to go into the medical field, feel free to reach out to me.
That's awesome. Yeah. I will jump in and tell the story Kate referred to really quick. In another life, I would have been on this panel instead of running it. My family wanted me to be a doctor, but when I got into college, just the pre-med world was not a right fit. But as soon as I became a teaching assistant, I knew like I had to teach this stuff. And I'm lucky because almost every healthcare career comes through me, right? I teach the prereq, and I get to see so many of you starting out, and it's really like today has just, I'm going to share this with all of my classes once we have the recording, because I think these are the things that they need to hear, you know, and so I've been great. I'm going to ask Anna, I don't know how you pronounce it, but do you have any questions for the panel as we wrap up today? Thank you for joining us. We're really glad to have you here. But anything in particular that you would like to ask, you can put it in the chat. You can turn your mic on. Just let us know. Great, please. So the question was, what was your biggest inspiration? I think we addressed it a little bit earlier, but if anyone wants to pop in and say, you know, just a quick overview of that one again, we can definitely do that before we wrap up. So you don't have to go in order this time.
Sorry, I'll Jen. I don't like silence. I live in a house with 3 young children, so I don't know what silence is about anymore. I was one of those kids who always knew that I was going to go into medicine, and so it was an easy decision for me. And you know, we talked about what inspires us to stay is that we have an impact on people all day, every day. We reach a lot of people and help them through what can be some of the most difficult times of their lives. And we also help them, you know, live longer or live better or live happier or live healthier to be around for their family members and stuff. So I just think it's a cool thing to do.
And we had other stories, family health crises, right, that really inspired everyone to get into the field and just, you know, wanting to help people and figuring it out along the way. But not everybody knew right away, but kind of hit along. Anything that we didn't cover in the questions that anyone would just like to add to kind of maybe empower people who are thinking about pursuing this career, who might be about ready to go to college, who are in college now? Like any closing statements that anyone would like to make as we wrap up the panel today?
I think one of the things that I think it was a question like, what can you do to change like misconceptions? Definitely the language barrier that exists in medicine today is, the minorities, our Hispanic, population. We need more healthcare workers, nurses, PAs, doctors, physical therapists that speak Spanish. And I understand sometimes one of the misconceptions is like, well, I didn't go into the field to be a translator. You're not translating. You're helping a patient who needs you, who has a barrier and they don't understand what's going on. And if there's something you can do, if there's something that you have, like the bilingual, you speak Spanish, I would say work on that now if you're not comfortable with like the medical terminology. I am still not comfortable with the medical terminology. I barely sometimes understand it in English, but we have the language lines. And sometimes for myself, when I have time with a patient, I'll be like, you know what, like, let me get the language line, but I'm also going to be here just in case if there's something I miss, just in case if there's something that I need to address, or in case if I get stuck. You have resources, you have those resources, so use them. There's one thing, like, you don't ever feel like you need to know everything. Something that we always talked about in nursing school with Ms. Herman was a nurse that knows everything is a dangerous nurse. So use your resources, please. Like, really, if you need to like download Google Translate just to, every once in a while look up like, how do I say this? Or how do I explain this? I do that. Don't ever feel like you're 100% set. This is a continuing education. This is a continuing learning experience. Even after you graduate and you get your license, whether it's a nursing, a doctorate, a certificate for NP, or a physical therapist, you're always going to be learning. This school thing is forever.
Yeah, and just to follow up on what Jeanette said, I totally agree with her. We need more people that speak Spanish, more professionals. It's so important, especially in this area where there are so many, people of Hispanic descent who that's their primary language. It's just so great for them to have people that look like them and can speak to them, even if maybe your Spanish isn't great. I know people's, own skills vary. It's so important. So don't think that's a positive. If I was, an employer, I want that person. I want that person right now. I wanted that person yesterday. And the other thing I would emphasize that Jeanette mentioned is that everybody in healthcare works as a team. And this is something that has actually become a bigger and bigger issue in healthcare in general, interprofessionalism and teamwork, and how really from top to bottom, everybody works with everybody else. And we are always, the best healthcare systems are ones where everybody works as a team, everybody's comfortable asking questions and talking to each other, and is all, even you have a physician, you have the therapist, you have the nurse, we all have a role to play, we all support the patients, and we all have our own insights. And we always need to sometimes go to like she just said, sometimes you need to go to somebody else to make sure that you're correct, or to make sure that you've got it right, or maybe you're just not sure. And some of the best, and I've heard physicians say this, that, especially when they're residents, they listen to the nurses very carefully because they know they have the experience that they don't. And they're like, I remember one resident telling a story about how he wasn't really sure about something, and the nurse was kind of like, oh, we're going to do this, this, this. He's like, yeah, that's what I'm going to do. So we all have a lot to learn from each other. And like she said, I mean, there's a reason why in physical therapy, for the clinical experience, the level for like graduation, it's called like entry level, and we emphasize the term competency. And competency doesn't mean you're great at it. It means that you're just where you need to be, because we know that when you graduate, you really are at an entry level, and it's going to take years for you to kind of develop your style and the experience. And that's true for everybody. And it's one of the reasons why we all got into the field, is because we like to learn and we'd like to grow and develop.
One last thing that I want to say is, I would say the only thing standing between you and your dreams is yourself. And that was definitely the case for me. I got a late start to my career because I was afraid of the medical field, because I was like, oh, everybody seems so smart and I don't think I can do it. But I learned very quickly that you cannot be happy in something that it's not what you want to do and you're holding back because you're afraid. So I would say throw that off to the side, and it is going to be really, really hard. But if it's what you want, then it'll be very happy, and it'll be very, it'll still be hard, but it'll be very rewarding. And the medical field is so much fun. So I encourage everybody, if you're interested, to just, you can do it. You really can do it. As long as you get yourself out of the way, your own way, then you can definitely do it.
In case you need to hear it, you are wanted in our field. Universally, we want you. There is such a broad range. I mean, you can see it here. We have a broad range in this handful of people here. But there is a huge range of people. If you go to the hospital, the employees that you see are this huge range of people with different abilities and different strengths and different weaknesses, and we complement each other in that way. And people are afraid to screw up or to not do it right or to not be good enough. You're good enough and you can do it as long as you put your mind to it. We have a shortage of healthcare employees right now. Everyone knows about the COVID situation. And I mean, it's not just that. Pre-COVID, we had shortages of a lot of healthcare employees, and that's going to continue as we ramp up with the COVID situation. And then who knows what's next. So do not be afraid. Get out there and do what you're passionate about, because we want to start training now so that you can get out here with us.
Awesome. Thank you all so much for taking time out of your Saturday to be here to share your experiences and your thoughts. This has been so uplifting and encouraging. I love that. Like, we want you, come work for us. Like, that's, I think, what a lot of people need to hear. And that if it's what you want to do, go for it. We are, Anna, just so you know, we will be sharing this recording. So you've registered, you'll get a copy for some of the questions that were at the beginning. So don't feel like you've missed out on those. We will make sure that you get a copy of that. And our conference continues through the rest of the month. So keep an eye on the website. We have sessions throughout next week up through the 31st, and we hope that you are able to join us. Still some exciting things to come, but we just really appreciate it. This was a particular panel that past participants in this conference asked for. We'd done a couple of women in STEM, and they said, but what about healthcare? You know, we really want to hear from women in healthcare. And so thank you again for taking the time. We appreciate you so much. We hope you have a fantastic rest of your day. And yeah, thank you. Thank you so much for coming, Anna. And that will be the end of our panel.
Thank you. Thanks, everybody.
Bye.
Bye.